Hey there, everybody. Another Nested Knowledge Super User webinar. My name is Jeff Johnson. I'm the Chief Design Officer over here at Nested Knowledge. I'm joined today by Evelyn Rizzo, one of our oldest customers, I think, somebody who has been using Nested Knowledge for the longest time. Evelyn, do you want to introduce yourself and tell us a little bit about what you do over at Mobility HEOR?
Yes, thanks, Jeff. Well, my name is Evelyn Rizzo. I have a clinical background, rehabilitation science, and I've moved over into the medical communications HEOR space just out of necessity because there wasn't enough evidence to support some of the amazing technology that my clients and my patients needed. So I've been originally introduced to the Nested Knowledge platform 3 years ago, just as a means to do systematic literature reviews. But a lot of our clients had many different evidence needs. So we were able to use Nested Knowledge for a lot of different ways.
Nice. Yeah. So I remember those days very, very vividly. That was kind of like that was the early days for me as well, I would say. So I joined Nested Knowledge probably 2 years into the founder's journey of creating this product, and your team came in, and you were probably among like our first professional users. Like up until that point, we were an academic focused product a little bit more so. We still obviously sell a lot of software to academics, and we enable a lot of academics to do systematic reviews every day in our platform. But that was kind of a nice sea change to see, okay, this is some of our first users coming in and using this for business, which was a big deal to us at the time. So you Evelyn are among our earliest adopters. Bring me back to that time again. Refresh my memory as to what our software looked like and felt like to use during that time when you first hopped into it.
Well, it was certainly easier than an Excel sheet, but it has grown by leaps and bounds over the last 3 years. So if my memory is rusty since I am your oldest customer.
I should not have said oldest. I should have said earliest. Earliest. You're not our oldest. They're certainly older
No
customers.
Yeah. But, yeah, I mean, the system, there weren't as many automated features. There was still a lot of, even though there was the promise of AI, there was a lot of manual work that went into it. So we still, I don't even know, a RoboScreener may or may not have been an early, you'll have to refresh my memory there.
I actually don't remember either, to be honest.
Yeah,
I don't know if
RoboScreener using RoboScreener initially. We had the 2 screeners and then the adjudicator. So that part was within the tagging system. There were suggestions, so that was helpful, but they weren't the AI-driven suggestions.
Right, they were search suggestions, which we still have. Like the standard recommendations or whatever is what we call them. But yeah, right.
Yeah, so that definitely is an improvement from that standpoint. And also, the inclusion exclusion probabilities, that to me has been a big time saver, especially, let me go into more detail for our audience. Initially, that was not a feature, but now what is a feature that I use quite frequently is when it models after you've searched and screened 50 articles and you've included 10, the model then can predict whether or not you're going to include or exclude articles. So that's something, a way to, if you need an answer fast and you've got the day to do something, it really, really revolutionized my workflow in that way.
Yeah, okay. So that makes me think that RoboScreener was around during that time, or maybe was not if you don't remember it being there, because that is powered by the same thing. So that's interesting. Okay. So the team that you were on at that time found some early success with kind of an interesting and I think still kind of novel use case for Nested Knowledge. And I really liked what the marketing department over at the company that you used to work for before you founded your own deal over at Mobility HEOR. I really liked what they cooked up. They called it a living evidence library, or living evidence synthesis library, maybe. I can't remember which the exact term was, but it paired a couple of things together that I really liked. First of all, it was living. So even back then we had, searches that updated on schedule, et cetera, right? And this ability to kind of bring in evidence and update a review quickly. Um, Tell us about why that was important for your team as a way to kind of market yourself and using nested knowledge. And tell us a little bit more about what you were up to with the living evidence synthesis library.
Well, you know, here's how the opportunity presented itself. You know, we
Okay.
were pitching, you know, different kind of HEOR projects, including SLRs. And the way it kind of worked out with this particular client is, you know, like they're like, well, we have SLRs. You know, we have every department does their own SLRs. We've got these, you know, stagnant piles of research, you know,
Mhm.
sitting in everybody's offices. And, you know, when we have, you know, 10 different therapeutic areas within this organization, you know, these people are doing extra work. You know,
Yeah.
nobody knows what other people have worked on. You know, how can we start building an evidence library that people can jump in at any point and see where people left off? You know, we're building
Yeah.
on the research. We're not starting from zero every project. So
Right.
um, how can we do that? And we saw the nested knowledge platform as an opportunity to provide a solution. You know, it's not we, you know, just with the dashboard. You know, how can we
Yeah.
make this a user-friendly experience where people from all parts of the organization, you know, commercial, you know, market access, you know, the evidence teams, how can
Yeah. Yeah. Yeah.
enjoy one single platform?
Yep. Yep. Just pulled up because I remembered the visual that we cooked up after we over at Nested Knowledge heard about how you were using Nested Knowledge, and this is like the little animation I remember building. I think Carl internally dubbed it the Wheel of Pain because it looks like it's like something that you're going to have to do, and like yes, because you're going to go around in a circle or something. But the idea is way more exciting than that. It's actually something that really got us excited, and I think helped you guys with your business at that time. The idea is basically you've got a whole bunch of external vendors who are all doing a systematic literature review or provisioning evidence for that particular like department within the pharma organization. And what's really kind of inefficient about that is that this is spread out across the product life cycle, right? So as you're developing your product, first you got to get research development in there, but that evidence is going to fall out of date by the time it actually hits the HEO market access team. So they're going to have to go out, do an entire new project. It's going to be a new budget. It's going to be a new everything. And so the idea behind kind of what you were doing at that time, which was brilliant, is brilliant, is that you can provide this evidence at the very beginning to the people who need it, to the department that needs it right then and there, and then you can start to build on that evidence as needed and keep it in date as you move through that product life cycle over 2 years, 5 years, 10 years, right, and move your way through that and make sure that everybody has full access to that evidence synthesis library. So I'll turn this off because it's just repeating. But yeah, that was kind of the idea back then, and I really it just captured my imagination. I really liked it. I thought it was brilliant. So yeah, so let me get back to the questions we have here. So post those days, much later. Eventually that you left that company and you started your own gig, which you call Mobility HEOR. I'm going to throw this up on the screen so our audience can view this. You can scan that QR code and you can check out Mobility HEOR. This is Evelyn's website, and you can certainly contact her there as well. What's you took nested knowledge with you, obviously. You kept using nested knowledge, and you are our most veteran user of nested knowledge at this point, right? Tell us a little bit about this new venture, Mobility HUR. What are you doing over there? How are you using nested knowledge over there to keep your business going?
Well, there's a lot of use cases. So, I have lots of clients that do many different things, but a lot of small startup clients
Mhm.
I've worked with. They're just early funding. Getting their first, second seed round of funding, and they want
Yeah.
to know, anything about the market, anything about their product, and this is where, these rapid reviews can come in really handy
Hmm.
and in line with their very tiny budgets. So for
Sure.
the new companies, I can easily do kind of a landscape analysis of where, what's going on in the market segment that they're interested in putting their product, and just give them a little, what I call like a value assessment, or a value analysis, and it's a very budget friendly product
Yeah.
that I rely on the Nested Knowledge platform to just do. It's not a systematic review. It's just
Yeah.
What I call desktop research for these companies, just to give them an idea to even generate more funding. So then they have this information, they get more funding, they have a very successful exit and make
Yeah.
dozens of dollars, and the patients get cool technology. So
Nice. Cool. So okay, so you're doing a lot of cool things. I'm coming back to that same question we had at the beginning. You talked about a little bit about what MK looked like back then. What does it look like now? What does it look like now for you as a user, you as a business owner, to come in and use Nested Knowledge today, and how has that kind of helped you?
Well, a lot of times customers are looking for solutions for a lot of different challenges that they're having. And just based on my experience, I can immediately start figuring out how can we use nested knowledge to make this happen. So
Yeah.
for another example, I have a client that works a lot. Their product is to kind of set up clinical trials, kind of get all the components to identify populations. Could we use nested knowledge for this? Absolutely. So
Yeah.
how can we set this up so that we can find patient populations, find, validated methods for identifying patients with particular disease states in the literature, and how can we use nested knowledge to do that? So, there's a dashboard feature that is also, that's a new feature. And using the tables, we can
Yeah.
set, you can use all the, statistical validations, put those in a table format, and you can really help support how you're going to identify these patient populations for clinical trials.
Mm-hmm.
So
Mm-hmm.
that's
Cool.
definitely a use case that wouldn't have been possible with the first generation of the
Sure.
Nested Knowledge platform.
Sure. So kind of related to that question, is dashboard your favorite feature, or what is your favorite feature within the NK platform?
Well,
New, old?
I do love the dashboard feature. I like, just the starburst. I think it's really user friendly and it gets people excited. So when it comes to, my husband says I don't explain what I do very well, but I feel like when you show somebody something like that and they can push the buttons, then it makes sense to them, and it makes literature easier to consume. You know what I mean? Like someone thinks,
Sure.
oh, you have to be a research scientist to understand the literature. But the dashboard feature is excellent, but also just the Starburst feature as part of the Nested Knowledge platform, I think can
Sure.
really include a lot of people into the collaborative efforts of, first off, just learning about something, learning about a therapeutic
Yeah.
area. Yeah. I just think
Yeah.
that
Yeah. Yeah.
it's a really, to me, user-friendly way to get information.
Yeah, so by Starburst, just for our audience who maybe are a little unacquainted with the Nested Knowledge platform, you mean the qualitative synthesis,
Correct.
visualization, yeah, side of things. So this is kind of how this feature works. You can click into this hierarchically organized starburst, sunburst, whatever you want to call it. This diagram, which I believe was first literally penned by like Florence Nightingale, which maybe I can find that and share with our audience as well. But anyway, yeah, this visualization type is somewhat useful, because you can go, okay, I'm going to look at serious adverse events, and then I want to look at some patient characteristics, existing medications that they're on, and beta blockers, and look at the intersection between those tags, as we call them, and view the studies that have returned from that kind of really quick query, that really quick like drill down into the data, and that's a useful way to kind of organize information.
Easy.
Okay, so yeah, and easy and fun. Hopefully that's kind of part of it, I think.
Mhm.
Okay, yeah, but let's also turn to kind of the dark side of that favorite feature question. What's the inverse of that? What feature are you still waiting for that we haven't designed, we haven't developed over here at NK? What do you need? You
Ah,
know?
well, I mean, the tables are still kind of a pain point for me. I mean,
Yeah, fair.
I use the tables all the time, but the copy over feature isn't work. That doesn't work the same as it
Mhm.
does in the tags. So
Yeah.
that can become cumbersome. So I'm waiting for that action to happen.
Yeah,
Um,
yeah, fair, fair. That's a really hard problem to solve, and it's something that I am passionate about solving, but it's really complicated. Basically, what you want, if I can just paint the picture for your audience, what you want to be able to do is look at a PDF, highlight a section, which is probably a table, and then just have it kind of magically be extracted into either like a tag table, right, like a qualitative table,
mhm.
or maybe even better, more fancily, be extracted into a data element. Where you've got the time point captured, and you have each of the arms captured. That would be ideal, right? So that'll be next. Maybe that's an ongoing project, something we're working on. And yeah, we agree. I think I agree with you, Evelyn. We
Yeah.
want that, you know? No,
I've
go
played
ahead.
around with copying it into Excel, so it's in the
Yeah,
grid format, and then it
yeah,
doesn't. It's worked like once out of 10 times, so it doesn't always
yeah,
work.
yeah. That's totally fair. I think
Yeah.
that's also true. Cool. So I've kind of shared a little bit of like an overview of what NK looks like. But I also know that you have a real project that you want to talk about. It's more of a passion project. Obviously, you can't share client work on this call, but I want to get into that. And also, folks, I should say too, if you're out there, I know I see we have some viewers out there who may have questions. If you have questions for us today, feel free to ask them in the chat. You can just type them out, whether you're watching on Facebook, on LinkedIn, on YouTube, etc. And you can ask your questions live, and we will attempt to get them. That said, I know a lot of you are watching after the fact, and that is okay too. You can hit up Evelyn on LinkedIn by scanning this QR code, and she will answer your questions after the fact too. So yeah, feel free to reach out. Evelyn, do you want to talk a little bit about your passion project, this prosthetics project, and maybe share a visual so people can get a sense of what NK is capable of and what you're capable of?
Absolutely. I do see that we have a question, Jeff. Though, should
Oh, you
we?
sure? You want to dive into the
Uh,
question? Sure. Let's
yeah.
do that.
So
Yeah.
Jose,
So
you see
go
that?
ahead. Yeah. Okay. So Jose Garcia says, can you speak to product market fit? Is that a process that nested knowledge can impact, or is that out of scope? Evelyn, you're our expert. You're a resident expert. You answer it.
Well, it can be used to determine product fit. So, I mean, I'm just going to speak from a startup
Yeah.
standpoint, and Jose, you can, fill in that if I'm not answering your question properly.
Yeah.
So, you know, it can help me see, what if competitors have published research, and then from that, I can take that information, find competitors, look up if it's the FDA approved product,
Mm,
that it kind of helps follow the chain of, who's built, are these approved products, has reimbursement been established, and then just kind of compare my client's projects or their device with things that have already been published on, approved, or reimbursed. So that helps me determine, well, it's very similar, is it going to be a 401k approval process? Do they need FDA approved? It looks like it's a very similar product. And, what research do they need building off of this research that's already been done on these similar products?
I think that's a great answer. Everybody needs evidence, right? At the
Yep.
end of the day, sometimes to a greater extent, sometimes to a lesser extent. So that makes sense. Yeah. Do you want to share your screen, Evelyn, or
Oh,
I
yeah.
can certainly, and let's dive in. I want to share. And by the way, folks, I can also toss this up as well. So prosthetic outcomes. If you want to view this yourselves after the fact, or just check it out, this is Evelyn's like passion project, and it's built with nested knowledge. So go ahead, Evelyn, take it away.
So I actually bought this URL a year or so ago because my transition to HEOR was based on a lot of my patients struggling with reimbursement, getting denied for prosthetic technology that could have really improved their independence and let them live at a level that they want to live as far as their mobility. And every time I had to go and just try to find an article or get all these doctors' notes together to, fight the appeal or the denial. It just took a lot of time out of my, clinical practice, and it wasn't reimbursed time. So obviously that creates an issue for, my employer. So the reason I even went over to HEOR is because I didn't feel like the evidence base had been established for prosthetics and orthotics. And it's something that the field has been working on and improving upon over the last few years. So it definitely, the momentum for evidence is there and it's building. But I want to make sure that clients, not only can clinicians easily find evidence, because not everybody is a researcher. Some people are only in love with the clinical part of work, which is awesome. They're passionate about patient care. Maybe they don't have time to, do in-depth research. So this project, I've created a nest focused only on lower limb prosthetic outcomes. But my plan is to build this out. This includes 80 articles, and people can go in here and they can check the synthesis. They can go in here. They can look for BK, and I'm sorry, I'm using abbreviations here. So that means below knee. So it's an amputee with a below knee amputation. We can look at is there any information about CMS coverage and fall prevention. So what this should target is evidence about technologies, prosthetic devices that hopefully prove that fall prevention or link fall prevention to these technologies. And then people can, download this by, clicking on here and generating this file. They could have that evidence, or they can just click in here, check the tags, and get, an overall sense of the information that's out there. They can even click through here to PMC, see the full text article. It'll all be here. I want it to be a resource for, the amputee community and clinicians, just as a point of reference for reimbursement. And I have lots of plans to improve it. I've been sending this to academics, like my professors at University of Pittsburgh. A little shout out to Pittsburgh. Just to see how we can improve this. One way I think it can be improved is by adding, a plain language summary to every article, and that's just in progress. I don't know if that's something that Nested Knowledge could generate for all these articles.
I would love to work on that. Yeah, it's a complicated problem again, but yeah, it's a totally fair point.
Well, I saw that there is there's a website with a plain language summary generator that I'm planning on using to insert the plain language summary as the top of each one. But I wonder if there's a way to integrate the software.
I think yes. So I think that there should be. We have strayed away from any generative functions thus far because we are so concerned with accuracy. So when you're summarizing that many tags, it can hallucinate, right? And there's no guard against that right now. So yeah, we don't necessarily want to get that out there and go. Just to our users that this is going to be perfect, because then people will start to trust it, right? So I know you, Evelyn Rizzo, will go out and when you generate your summaries, we'll check each one, vigorously to ensure the highest standards of quality. But not all our users are that competent, right? So that's something that we worry about. Like people just will click generate on each one and go, yeah, I'm done with my job for the day. I'm going to go make a cup of coffee, or worse. They're going to see it and then they're going to blame us because we generated a summary for them and it was bad. It was wrong. So that's the risk. We will, I promise you, we will have a feature like that someday. we
Yeah.
might have to wait for large language models to get actually smart before that happens. I don't know. But it's a great idea, and I share your enthusiasm for it. Jose Garcia, by the way, says thank you. That was very powerful, actually, Evelyn. If you have questions out there for Evelyn, don't hesitate to drop them in the chat right here. We're kind of getting towards the end of the half hour here. We do have time for more if you want to ask them. Otherwise, of course, you can always go to mobilityheur.com and check out her website, or you can just message her on LinkedIn, and I'm sure she would be responsive to that, and she can help you regardless of where you sit in that product life cycle, regardless where you sit within the farm organization, regardless of how big you are. I think Evelyn could probably help you. She's focused on startups right now, but startups grow, right? So yeah, everybody needs evidence at every stage. Um, yeah, Evelyn, what would be like one call to action that you have at the end of this webinar, just given like where we've landed, what we've talked about today? What's one thing you would like people to know about Mobility HEOR, about your work? What's something they should do right now after this webinar ends?
Well, it's never too late or never too early to start an evidence generation plan for a new product. I mean, really, a lot of times it seems like people wait too long to start the evidence generation strategy piece. So, just talking to someone early on, just to find out what's already out there, what you would need to get reimbursed. How do you support the product with evidence? Because if you don't have evidence to support it, your patient target is never going to get your amazing product. So that's what I'm passionate about, is making sure that we can find the evidence, we can develop the evidence, strategies for, I can help, with manuscripts, that just kind of building that platform so that your product is ultimately received by patients that need it the most.
That's a great call to action. I will add one of my own. You can sign up for Nested Knowledge and you can create your own passion project today for free. So if you go to nestedknowledge.com, and if you're passionate about prosthetics, if you're passionate about anything under the sun that requires that kind of systematic review of evidence, you should go to nested-knowledge /sign up. And I'm just going to draw. I think I have a QR code for that. Yeah. Here we go. Just scan this QR code and you will be able to not necessarily use all of the fancy AI tools, but you can complete an entire systematic review with those embeds that Evelyn just shared, just like she did. And you can create your own systematic literature review from scratch. So go do that. If you have a subject that you're passionate about, you want to research. Evelyn, thank you so much for joining me today. This was really a fun webinar. Let's do it again soon.
Thanks, Jeff.